Ever feel like your heart has a mind of its own? Skipping beats or racing ahead, or just feeling off? You're
Yeah.
not alone. Millions of people experience irregular heart rhythms.
Right.
And for many, the answer lies in a class of medications called antiarrhythmic drugs,
Meh.
ADs for short. But here's the thing. These drugs are not your average take two and call me in the morning kind of pills.
Mm-hmm.
They're powerful, they're complex,
Mm-hmm.
and they require a deep understanding of how they work and how they interact with your unique body.
Yeah.
That's exactly why we're here today, diving deep into the world of AADs
Mm-hmm.
with incredible source material provided by the London Heartbeats Beat Academy in the UK. Make sure you're following them on Facebook, Instagram, Spotify, and YouTube for more deep dives into the fascinating world of cardiology.
It's true. AADs are a fascinating area of medicine. And as you said, understanding them goes beyond just knowing the names. We're going to unpack how they work,
Yeah.
their limitations, and why a personalized approach is so crucial for safe and effective treatment.
All right, so let's start with the basics. We know AADs are designed to control irregular heartbeats. But how do they actually do that?
Traditionally, AADs have been classified using the Singh-Vaughan Williams system, which groups them based on how they affect the heart's electrical activity. While this system has its uses, it can be a bit like trying to fit square pegs into round holes. It doesn't always reflect the complexity of how these drugs work, especially when you consider individual patient factors.
So it's not a one-size-fits-all situation.
Not at all. In fact, there's a growing movement towards a more holistic approach, what some call the Sicilian gambit. This method focuses on understanding the specific mechanism behind the arrhythmia first. It's like detective work. You identify the culprit causing the irregular heartbeat. Then you target that culprit with the most appropriate drug.
Okay, that makes sense. So instead of saying, here's a drug for arrhythmia, it's more like, here's the cause of the problem. Let's find the precise solution. But how is this Sicilian gambit more effective than the traditional way of classifying AADs?
Here's where it gets interesting. The Sicilian gambit recognizes that the same drug can have different effects depending on the underlying cause of the arrhythmia. Take, for example, atrial fibrillation, a common heart rhythm disorder. It can be triggered by a variety of factors, from high blood pressure to thyroid problems. The Sicilian gambit approach would involve identifying the specific trigger in your case and then choosing the drug that's most likely to address that trigger effectively.
So it's a more personalized approach, taking into account the individual's unique situation.
Exactly. And this is where things get really crucial because AADs have a narrow therapeutic window. This means the difference between an effective dose and a potentially toxic dose can be quite small.
Okay, that sounds a little unnerving.
Sure.
So how do doctors determine the right dose for each patient?
It's a delicate balancing act. Doctors consider a multitude of factors, including your age, genetics, other medications you're taking, even the severity of your heart condition.
So it's almost like each person's body has a unique fingerprint when it comes to how it processes and responds to these drugs.
That's a great way to put it. And this fingerprint can change over time, which is why regular monitoring is so important.
Now, I know we're diving deep into the complexities here, but let's talk about some specific conditions that doctors need to be extra careful about when prescribing AADs. I'm thinking things like kidney disease, pre-existing bradycardia, or pregnancy. How do these factors impact the decision-making process?
These are all critical considerations. For some,
That makes sense. It sounds like it's all about finding that sweet spot, the right drug, the right dose, to maximize benefit and minimize risk for each individual.
exactly. It's truly personalized medicine in action.
Speaking of personalized medicine, I know there's a lot of buzz around pharmacodynamics. This idea of analyzing your genes to see how you might respond to different AADs. Can you tell us a bit more about that?
Pharmacodynamics holds immense promise for the future of AAD prescribing. Imagine a world where we can predict with a high degree of accuracy which AAD is most likely to work for you based on your genetic makeup. This could help us avoid trial and error, minimize side effects, and optimize treatment outcomes.
So it's like having a personalized roadmap for your AD journey, guiding doctors towards the most effective and safest options.
Precisely. And while this technology is still evolving, it's already starting to make a difference in how we approach AD therapy.
Now let's shift gears a bit and talk about a very specific scenario where AADs play a crucial role post-operative atrial fibrillation, or Afib, basically an irregular heartbeat that can occur after surgery. It's more common than you might think, and it can be quite a scare for patients.
Post-operative AFib is indeed a concern. And the good news is that we're getting better at preventing it. Beta blockers, those familiar medications often used to control blood pressure and heart rate, have been shown to be quite effective in reducing the risk of AFib after surgery.
So it's like giving your heart a calming influence before it goes through the stress of surgery.
Exactly. And in cases where AFib does occur, we have drugs like Vernakalant, which acts very rapidly to convert the irregular rhythm back to a normal sinus rhythm. It's often the preferred choice in the postoperative setting due to its rapid onset of action and generally good tolerability.
So we have preventive measures and emergency measures in place. That's reassuring. But here's where things get a bit paradoxical. We've been talking about how AADs help control irregular heartbeats, but sometimes they can actually trigger more rhythm problems. This is known as proarrhythmia, and it can be quite serious.
It's a real concern, and it highlights the importance of careful monitoring and individualized treatment. Proarrhythmia is often related to specific drug characteristics, individual patient factors, or even interactions with other medications.
So what are some red flags that might suggest proarrhythmia is happening? And what should patients do if they experience these symptoms?
Severe palpitations, feeling faint, dizziness, or even syncope. These are all warning signs that shouldn't be ignored. If you experience any of these symptoms while taking an AAD, it's crucial to contact your doctor immediately. Early recognition and intervention are key to managing proarrhythmia effectively.
And this brings us to another important point. AEs can have effects beyond the heart. We've been focusing on heart rhythm, but these drugs can also impact other organs.
Right. And amiodarone, a commonly used AAD, is a prime example. It contains iodine, which is essential for thyroid hormone production. But sometimes amiodarone can disrupt this delicate balance, either leading to an overactive thyroid, hypothyroidism, or an underactive thyroid, hypothyroidism.
So regular thyroid function tests are essential for anyone taking amiodarone.
Absolutely. And it's not just the thyroid. Amiodarone can also affect the lungs, liver, eyes, and even the skin. So comprehensive monitoring is essential for ensuring its safe and effective use.
It's a good reminder that these are powerful medications with potential side effects, and close collaboration between patient and doctor is key. Now, before we move on to some specific examples of how AADs are used for different arrhythmias, I want to take a moment to thank the London Heartbeat Z Academy for providing the insightful materials that are guiding our discussion today. For our listeners, be sure to check them out on Facebook, Instagram, Spotify, and YouTube for more in-depth explorations of cardiology. They're a fantastic resource for anyone who wants to learn more about heart health.
It's amazing how far our understanding of the heart and its rhythms has come.
Yeah,
But there's always more to learn, isn't there?
absolutely. And one of the things that still fascinates me is how AADs actually get around in the body. We talk about taking a pill, but there's a whole journey that drug goes on before it starts doing its job, right?
It's a fascinating journey indeed. We call it pharmacokinetics, basically, what the body does to the drug. It involves several steps: absorption, distribution, metabolism, and elimination.
Okay, let's break that down. Starting with absorption, what does that involve?
Absorption is how the drug gets from where you take it, like your stomach, into your bloodstream. And believe it or not, this can vary depending on the specific AAD and even how you take it. Some are best absorbed with food, while others need to be taken on an empty stomach.
So it's not just about swallowing the pill, it's about creating the right environment for that drug to get into your system.
Exactly. And once it's in the bloodstream, we move on to distribution, which is how the drug spreads throughout your body and reaches those heart cells it needs to act on.
I imagine this is where things can get complicated, given that different AADs might have different destinations in the body.
You're right. Some AADs tend to accumulate in certain tissues more than others. Amiodarone, for instance, has a long half-life, which means it stays in the body for a while and can build up in places like fat tissue.
So that long half-life, does it mean the effects of the drug also linger longer?
Yes, it can provide more sustained action, which can be beneficial in some cases. But it also means that if someone experiences side effects, they might persist even after stopping the medication.
Okay, starting to see the complexity here. So we've got the drug absorbed and distributed. What happens next?
Next comes metabolism, or biotransformation, as it's sometimes called. This is where your body, primarily the liver, starts breaking down the drug. It often transforms into what we call metabolites, some of which can still be active and have their own effects.
So it's like the drug goes through a transformation within the body, and these transformed pieces might have their own unique actions. That's a good way to think about it.
And finally, we have elimination, the process of removing the drug or its metabolites from the body, mainly through the kidneys.
And I imagine this is where conditions like kidney disease can really come into play.
Absolutely. If someone has impaired kidney function, their ability to eliminate certain AADs might be reduced. which could lead to higher drug levels and a greater risk of side effects.
So all these factors we've talked about, age, genetics, other medications, and now these pharmacokinetic processes, they all intertwine to create this incredibly complex picture of how each person responds to ADs.
Precisely. It emphasizes why a one-size-fits-all approach simply doesn't work in this area of medicine.
So given all these complexities, how do doctors actually go about choosing the right AD for a specific patient? What are the key considerations?
It's like solving a puzzle. It starts with understanding the type of arrhythmia a person has, the underlying cause, if known, and their overall health status. For instance, if someone's atrial fibrillation is triggered by an overactive thyroid, addressing the thyroid issue might be the priority before even considering AADs.
So it's not always about jumping straight to medication. It's about understanding the root of the problem.
Exactly. And then, of course, those individual patient factors we talked about come into play. Someone with kidney disease might not be a good candidate for an AD that relies heavily on the kidneys for elimination.
And what about those tricky situations where a patient is taking multiple medications? Drug interactions can be a real concern, right?
Absolutely. Many AADs can interact with other drugs, potentially increasing or decreasing their effects or even leading to new side effects. Amiodarone, with its long half-life and tendency to interact with other medications, is one that requires particularly careful monitoring.
So it's like a delicate ecosystem. You have to be mindful of how each element, each medication, interacts with the others.
That's a great analogy, and this is why having a complete and up-to-date medication list, including over-the-counter drugs and supplements, is so crucial when you're discussing treatment options with your doctor. It allows them to assess the potential for interactions and make informed decisions.
Okay, so we've talked about how complex AEDs are, how they work in the body, and some of the factors that influence their use. Now let's dive into some specific scenarios and explore how AEDs are being used in practice today.
Sounds good. Let's start with something relatively common, ventricular premature beats, or VPBs. These are extra heartbeats originating in the ventricles, the lower chambers of the heart.
I've heard of those. They're often described as feeling like a flutter or a skipped beat. Are they always a cause for concern?
Most of the time, VPBs are harmless and don't require treatment, but in some cases, they can signal an underlying heart problem or lead to more serious arrhythmias.
So how do doctors decide when to use AEDs for VPBs?
It's about weighing the potential benefits against the risks. If someone has frequent VPBs, particularly if they're causing bothersome symptoms like palpitations or dizziness, or if there's concern about an underlying heart condition, then AADs might be considered.
But I imagine there's also a growing awareness of not overtreating, right?
Yeah.
Not using AEDs for every little blip on the heart's radar.
You're right. In the past, there might have been a tendency to prescribe AADs more liberally for even benign VPBs. But now the approach is much more conservative, focusing on lifestyle modifications as a first line of defense.
So things like stress management, cutting back on caffeine, and getting enough sleep can actually make a difference for those with VPBs.
Absolutely. It's about creating a heart-healthy environment. And for many, those lifestyle changes can be remarkably effective.
Now let's talk about atrial fibrillation, or Afib, which is much more common than VPBs. It's basically a chaotic rhythm in the upper chambers of the heart, and it can lead to a range of problems, from uncomfortable palpitations to stroke. How do AEDs fit into the treatment picture for Afib?
Afib management often involves two main goals: controlling the heart rate and restoring normal rhythm. AEDs can play a role in both, but again, it's not always the first line of treatment.
So for rate control, we're talking about beta blockers again?
Beta blockers are indeed commonly used for rate control in Afib. They help slow down the rapid heart rate and improve symptoms. But other drugs like calcium channel blockers or digoxin might also be used depending on the individual's situation.
And when it comes to restoring normal rhythm, are AEDs the go-to choice there?
AEDs can certainly be effective for restoring and maintaining normal rhythm in Afib, but it's important to consider all options. There's also a procedure called catheter ablation, which involves using heat or cold energy to disrupt the abnormal electrical pathways in the heart that are causing the Afib.
So it's like a more direct approach targeting the source of the problem.
You could say that. Catheter ablation has become increasingly effective for Afib, but it's not without risks. And it might not be suitable for everyone.
So again, it's about personalized medicine, weighing the pros and cons of each approach and finding the best fit for the individual patient.
Exactly. And when AADs are chosen for Afib, there are several options available, each with its own profile of effectiveness and potential side effects. Amiodarone, as we've discussed, is often considered the most effective, but it also has a higher risk of side effects.
So it's about finding that balance between getting the rhythm under control and minimizing the risk of unwanted consequences.
Precisely, and that's where those newer AADs come into play. Drugs like Dronedarone, which is similar to Amiodarone but generally has a better side effect profile, are becoming increasingly popular choices.
So it's like having a new tool in the toolbox, one that might offer a better trade-off between efficacy and safety.
Exactly, and remember, research is ongoing, so our understanding of how to manage AFib and other arrhythmias is constantly evolving. It's a good reminder to stay informed and have open communication with your doctor about the latest advancements.
Now, we've talked about situations where ADs might be a second-line option after lifestyle changes or procedures. But are there cases where ADs are the clear first choice?
There are. A condition called Wolff-Parkinson-White syndrome, or WPW, is a good example. It involves an extra electrical pathway in the heart that can lead to episodes of very rapid heartbeat, or tachycardia.
So in this case, ADs are used not just to control the rhythm, but to actually block that extra pathway.
That's right. Certain AADs, like flecainide or propafenone, are very effective at blocking that extra pathway and preventing those episodes of tachycardia.
But I imagine it's a delicate maneuver, given that you're trying to block one pathway without disrupting the normal electrical conduction in the heart.
Exactly. It requires careful dosing and monitoring to ensure you're achieving the desired effect without causing unintended consequences.
And I'm guessing this is where the expertise of an electrophysiologist, a cardiologist who specializes in heart rhythm disorders, becomes really important.
Absolutely. They have the in-depth knowledge and skills to navigate these complexities and tailor the treatment plan to each individual's unique situation.
So we've covered a lot of ground, from the basics of AEDs to their journey through the body, their use in different scenarios, and the importance of personalized medicine. But there's one more crucial aspect we need to address: safety.
Safety is paramount, and it's something we've woven throughout our conversation. But it's worth emphasizing again that AEDs are powerful medications, and with that power comes the potential for risks.
We've talked about proarrhythmia, that paradoxical effect where an AD actually triggers more rhythm problems. But how common is it? And are there specific factors that increase the risk?
The risk of proarrhythmia varies depending on the specific AAD, the dose, and individual patient characteristics. Some AADs are inherently more likely to cause it than others. And people with pre-existing heart conditions, a prolonged QT interval on their EKG, or electrolyte imbalances are generally at higher risk.
So again, it comes back to that personalized approach, understanding your own risk factors and working closely with your doctor to choose the safest AAD and monitor its effects diligently.
Exactly. And it's important to remember that proarrhythmia is not the only safety consideration. As we discussed earlier, AEDs can have effects beyond the heart, and monitoring for organ toxicity, especially with a drug like amiodarone, is crucial.
Right. We talk about amiodarone and its potential impact on the thyroid, lungs, liver, eyes, and skin. It's a good reminder that these drugs can have wide-ranging effects, and vigilance is key.
Absolutely. And let's not forget about drug interactions. Having a complete medication list and being upfront with your doctor about everything you're taking, including over-the-counter medications and supplements, is crucial for minimizing the risk of adverse events.
It's about teamwork. You and your doctor working together to manage those heart rhythms safely and effectively. It's a lot to take in, isn't it? These drugs are powerful allies in the fight against irregular heart rhythms, but they demand respect
Yeah.
and careful management.
I think that's a great way to put it. ADs are not a set it and forget it type of medication. They require ongoing dialogue and collaboration between patient and doctor.
And speaking of that collaboration, what are some things patients can do to be proactive in their care?
Knowledge is power. Understanding your specific arrhythmia, the rationale for using an AAD, potential side effects, and those all-important warning signs. That empowers you to be an active participant in your treatment plan. Don't hesitate to ask your doctor questions, voice concerns, and be your own advocate.
Absolutely. And while medication is a crucial part of the puzzle for many, we can't forget about the power of lifestyle. It's something we've touched on throughout this deep dive, but I think it's worth reiterating.
Couldn't agree more. Lifestyle modifications are not just a nice to have. They're often a fundamental cornerstone of managing arrhythmias effectively.
So things like managing stress, getting regular exercise, maintaining a healthy weight, and being mindful of things like caffeine and alcohol intake. those can all make a real difference.
They absolutely can. It's about creating a heart-healthy environment,
Right.
both internally and externally. And while it might sound simple, those lifestyle changes can sometimes be the most challenging part.
It's true. Changing ingrained habits is hard work. But it's also incredibly empowering to know that you have some control over your heart health.
Exactly. And remember, it's not about being perfect. It's about progress. Small, sustainable changes over time can have a significant impact.
Now, we've talked about the present, how AEDs are used today, the complexities, the risks and benefits. But what about the future? What's on the horizon in terms of AED research and development?
That's where it gets really exciting. As we mentioned earlier, pharmacodynamics, the science of using your genes to predict how you'll respond to medications, is a game changer in the making.
Imagine a world where we can personalize AED therapy down to the genetic level, minimizing side effects and maximizing effectiveness. It's incredible to think about.
It truly is. And there are other exciting areas of research as well. Scientists are exploring new drug targets, focusing on the intricate mechanisms involved in heart rhythm regulation. The goal is to develop even safer and more effective AADs with fewer side effects.
So it's a continuous evolution, constantly pushing the boundaries of what's possible in heart rhythm management.
Exactly. And for patients, this means hope. Hope for better treatments, better outcomes, and ultimately a better quality of life.
Well, I think we've covered a remarkable amount of ground today. We've delved into the intricate world of AADs, exploring their mechanisms, their uses, their complexities, and the ongoing quest for safer and more personalized therapies. A huge thank you to the London Heartbeat Seed Academy once again for providing the incredible source material that made this deep dive possible. Listeners, don't forget to check out their Facebook, Instagram, Spotify, and YouTube channels. They're a treasure trove of valuable information on all things cardiology.
And one final thought for our listeners. As we've explored today, AADs are powerful tools, but they're most effective when used as part of a comprehensive approach to heart health. So be proactive, be informed, and work in partnership with your healthcare team to create a personalized plan that addresses your unique needs and goals.
Because when it comes to your heart, knowledge is power. Until next time, stay curious, stay informed, and keep those heartbeats steady.